Welcome to Morpheus ART. I'm Anita and I will be your friend and guide along the path of fertility treatment. The following information presented will inform you and help you understand the events that lead to conception, conditions that delay or hamper the conception, leading to infertility and subfertility, and how to overcome it in the best possible way. Normally, for pregnancy to occur, sperms are deposited into vagina and travel through the womb cavity into fallopian tube. This movement is a result of sperm motility as well as the undulating movement of the uterus and fallopian tubes. At around same time, ovary releases an egg which is picked up by tubal ends and travels through the fallopian tube where it meets the approaching sperm and fusion takes place. This leads to formation of an embryo which later would settle down in the womb and result into a pregnancy. There can be various causes which interrupt this normal course of events and lead to infertility. Incidence of infertility is shared equally between males and females. Sometimes, after running all the possible tests, no cause can be found for approximately 10% of couples, in which case it is called unexplained infertility. Let's have a look at causes of male infertility. Problem could be at production level in the testes, which is called failure of sperm formation. Or it could be a blockage in the duct transporting sperms, or a failure of ejaculation. Male infertility, the 4 parameters. The main parameter of the semen that are routinely evaluated are number of sperms, movements of the sperm, and abnormal shapes. Deviation in any of these can lead to male infertility. Male infertility can also be due to failure of ejaculation caused by diseased nerves. Let us now have a look at causes of female infertility. Anovulation refers to the inability of the female eggs to grow to a mature size and release at an appropriate time for conception to occur. This can happen due to hormonal imbalance at the level of higher centers or ovaries. It could also happen due to extreme stress, starvation, or excessive physical exercise. In polycystic ovarian syndrome, there is an imbalance in the fertility hormones released from the higher centers. This leads to a presence of numerous small follicles in ovary, none of which are able to grow and ovulate. Tubal factor. Infertility can also be caused due to unhealthy or blocked tubes. Blockage in tubes prevents the sperm from reaching the egg and fertilizing it. Pelvic infection and scarring. Any previous episode of pelvic infection, like tuberculosis, other bacterial or viral diseases, may lead to formation of adhesions and scarring in the pelvis involving the tubes and ovaries, leading to infertility or subfertility. The womb has a lining called endometrium, which grows and is shedded every month during menses. Presence of endometrial lining in abnormal places like over the ovaries, tubes, womb, and in pelvis is called endometriosis. It causes inflammation and is responsible for poor egg quality, subfertility, and infertility. Fibroids are benign tumors inside the womb or on the wall of the womb. When present inside the womb cavity or pushing against the womb lining and of large size, they can interfere with fertility and implantation. Uterine anomalies. The various abnormalities of womb, like presence of septum, presence of abnormal or double wombs, can lead to difficulty in getting pregnant and also cause higher incidence of miscarriage. While undergoing fertility treatment, you will go through some or more of the following processes: infertility workup, artificial insemination, fertility surgery if required, male treatment, IVF or ICSI, IMSI, cryopreservation program. Process of treatment: investigation, hysteroscopy, down regulation, stimulation, egg retrieval, IVF or ICSI or IMSI, embryo transfer. Infertility treatment will involve semen analysis to ascertain the important parameters as previously elaborated. Laboratory tests which involve hormones, infection screen, and a general health checks. You would also be asked to undergo an ultrasound of pelvis to evaluate the uterus and ovaries. Your doctor may also advise an evaluation of the womb cavity by hysteroscopy to rule out any abnormalities which may affect implantation of pregnancy. This is usually a daycare procedure and done under short general anesthesia. As a part of IVF or ICSI procedure, you would first undergo downregulation by means of injection to prevent your body hormones from interfering in the controlled egg growth. Once this is achieved, you will be started on another set of injections called gonadotropins to stimulate multiple egg formation in your ovaries. Once eggs reach matured size, they are taken out of the ovaries by a procedure called oocyte retrieval. It is a daycare procedure done under short general anesthesia and requires a few hours of stay in hospital. Once the follicular fluid is aspirated, it is scanned under the microscope to isolate eggs. The eggs are cleaned, washed, and placed in nutrient-rich and temperature-controlled environment. These eggs can be treated either IVF or ICSI. In IVF, each egg is layered by a specific number of sperms and kept in incubator for fertilization to take place. Each egg is placed in an environment containing a certain minimal quantity of good quality sperms. Over a period of few hours, a single sperm would enter inside the egg, leading to fertilization. However, this is a completely natural process, dependent on egg and sperm quality, hence not all eggs would be fertilized. In case of previous failed fertilization or poor quantity and quality of egg and sperm, you would be recommended an ICSI procedure. In ICSI, each egg is cleaned further by aspirating in and out of pipettes to free it from the layers of cell surrounding it. Each egg is now placed in a separate drop-in dish ready to be injected by a single sperm. The sperm is selected based on the shape and movement. The selected sperm is immobilized by squeezing the tail with a microneedle under microscope. Following which, one sperm is injected in each egg by micro-manipulation. Once the eggs are fertilized, they start dividing and form 4-cell embryos by day 2 and 8-cell embryos by day 3. The embryos are selected based on the pace of growth and appearance of the cells. The best embryos are loaded in a thin catheter and gently transferred to the womb under ultrasound guidance. This procedure usually does not require general anesthesia. Cryopreservation. In many cases, after the embryo transfer, there may be surplus good quality embryos remaining. The preservation maintains the embryos dormant in the original state for many years, safely in liquid nitrogen. These embryos can be thawed as per the requirement and used for transferring to the womb. Following are advanced techniques. IMSI allows us to magnify the sperm up to 6,000 times, enabling a better selection of sperms, especially in case of bad quality sperms. Laser-assisted hatching refers to thinning the zona of embryo slightly. It is most commonly recommended for women who have failed IVF cycles, poor embryo development, are age 38 or older, or have thickened embryo shells. Zona birefringence. The advanced optical system assists us in assessing the quality of the egg in a dimension that is not possible with conventional microscopy. Using this technology, our ability to select out better embryos for transfer is improved. There can occasionally be side effects of drugs and complications, like low response, hyperstimulation, anesthesia, and procedure-related complications. During the therapy, we try to minimize these risks and the complications of the procedure. Morpheus Advantage. International knowledge pool backed by leading fertility specialists from Germany with international experience in conducting successful IVF, ICSI treatments. Vast experience in ART. Our associate centers in Germany have conducted more than 30,000 fertility cycles over last 10 years, getting 10% higher success than average in Germany. Latest state-of-the-art equipment. Our embryology labs are equipped with the latest state-of-the-art equipments imported from leading suppliers around the world. Dedicated and highly experienced trained embryologists. We have in-house team of specially trained and experienced embryologists for performing IVF, ICSI embryology procedure for ensuring consistency of performance. Uniform and fair pricing. All our centers in India have uniform price structure, which assures true value for the treatment selected by you. And above all, team of experienced gynecologists and fertility specialists. Our doctor partners and fertility specialists who are already well reputed in their fields are further trained in advanced management of fertility in our Germany center. Infertility causes can be many, but now there's a simple and economical treatments for the couple. Visit Morpheus Fertility Centers for counseling, and soon you would discover the joy of parenting. We at Morpheus wish to make your journey through fertility treatment as comfortable as possible. Please feel free to ask your doubts and queries during your detailed counseling session with our doctors and counselors. Thank you.